Medicare, our greatest accomplishment as Canadians in the field of social policy and public policy. Medicare, a program that has carried with it the values of fairness, of sharing, of cooperation, and compassion. It certainly identifies ourselves one to each other, and in some ways it identifies Canadians to the rest of the world. We know what we have to do to preserve and to protect and sustain our healthcare system. The time is now for action by the Canadians of British Columbia and Canada.
The BC Health Coalition is a 15-year-old broad-based network of organizations and individuals who support public health care in British Columbia.
We're seniors, we're women, people with disabilities, persons with AIDS, frontline health workers, and their unions.
And the overarching goal of the coalition is to basically engage every single British Columbian in the debate around health care and talk about how we can protect Medicare and expand public health care in BC through positive public solutions.
Whether it's the Conversation on Health report, the push for P3 development across this province, the increase of private clinics, the lack of good home support, and the low number of long-term care beds.
The BC Health Coalition has been a key actor and a key factor in making sure that the issue of public health care, which we know is essential to all Canadians, is maintained and stays in the public eye, on the public agenda, in the media.
It has already been decided what kind of health system we want. We want a one-tiered, publicly funded health system. And we will not settle for less.
For people living with HIV/AIDS, the cuts are already taking their toll. The delisting by pharmacare of certain drugs and cuts to welfare are making it even harder for many of us to preserve what health we have left.
Seniors again have to go and sort of man the barricades in many ways and engage in public policy discussions to make sure that the gains they made during their lifetime are protected in retirement. And there's really no greater program of interest to seniors today as the question of Medicare.
The values you seniors created and the value of Medicare has become a real heritage for Canada.
We want Medicare. We want it publicly funded and available to everyone.
Keep our health care free from greed.
Home support has been and continues to be the most cost-effective form of health care. It is a low-cost option that allows seniors and people with chronic illness to live their lives at home in comfort and with dignity. Research on home care, home support in British Columbia reveals some very troubling developments. Hospitals have been downsized without a parallel investment in home and other community-based care.
Why is it that Canada, one of the richest countries in the world, is one of the few Western nations without a pharmacare plan?
The most likely person to be covered by private health insurance benefits, and so therefore would have the easiest access to prescription medicine, they are likely to be male, over the age of 45, and in the highest income brackets. So that is the most likely to be insured. The least likely to be insured are female workers who are under the age of 25 and who are employed in the retail sector and are earning very low wages. That is the reality of the private insurance market, which really underscores the need for a national pharmacare program.
While they're meeting in the hotel there, they're talking about something they call P3s. They say it stands for public-private partnership, but we know it stands for lots and lots of problems.
There are many problems that I feel are associated with P3s or public-private partnerships. The first is increased costs. The second is a complete lack of public accountability. And the third big problem, in my opinion, is that the increased costs associated with P3s tend to divert money away from community patient care, from bedside patient care, from long-term care for our patients, into unnecessarily expensive administrative and financing costs.
Every layer of the press now discounts it in the UK, and indeed the UK government is rolling back on its own P3 policy just as it's beginning to promote and push it really hard abroad. And in the UK, it's been described by the media as mortgaging our children and our grandchildren's future.